Hello and welcome to Health Live at Seniors Today. We have a bit of a technical issue. Dr. Shaikh, who was going to be here, hasn't been able to join us so far. So Dr. Muzammil Shaikh, who is Director of Medical Oncology at the Nanavati Max Hospital, is going to be joining us any minute. But to those of you who have been regulars at the Health Live, you are aware of the fact that we start on time, regardless of whether the doctor is here or not. You can almost set the time, set your watch to 5 o'clock, and we will start at that time. Until the doctor is here, we are in touch with the doctor. Would any of you like to say something? Any requests for any doctor to come in, any specialist to come in? Katie, Dadanji, you are one of our regulars. Is there any suggestion that you have? I'm allowing you to talk. Mr. Suresh Ghate, you are also a regular. Would you like to talk? Yeah, Katie, would you like to talk?
How do I talk? Hello, can you hear me?
I can hear you. Yeah. I can hear you.
It would be very nice if we could have another homeopathy doctor also giving us some advice on certain medications that would help in certain illnesses.
Great. Yeah, we can do that. We can have a homeopath. Yeah, we can do that. Thanks. And how have you been? All well?
Yes, with God's grace, everything is great. Thank you for your very, very enlightening talks. My husband and I enjoy every minute of it, and we try not to miss it under any circumstance, if it's possible. So keep up the good work you guys are doing. It's really very, very educative for people like us. When we get a chance to ask simple questions to doctors and they reply you upfront immediately. It's very nice. And maybe even Mr. Maheshwari, a physiotherapist, if she can do simple exercises and tell us for a knee problem or a simple backache, a physiotherapist who can actually perform some exercises and show us, that would also be wonderful.
We've had a physiotherapist a few times. If you remember, we had Dr. Ali Rani.
Yes,
and we had Dr. from HN Reliance, Ashish Contractor. And we've also had a doctor from Binal Dave. So we've had a few, but I agree with you. See, what we keep getting doctors back, the same doctor or some other doctors. So
as far as I know, Ashish Contractor is not a physiotherapist, is he? In the Reliance Hospital?
He's not a physiotherapist. He's also a rehab, but which includes physiotherapy. But I agree with you. Physiotherapy is Ashish is more for cardio-related.
Yes.
But
that's right. He stays in my colony and I know him. That's why so that's why I was saying he's not the physiotherapist, the kind that I was thinking of.
How many doctors do you have in the colony?
There is Dr. Farokh Master, who is a gold medalist homeopath. I was in fact thinking of him because he's very good. He advises people on certain medications that would help cancer patients also, by way of homeopathy, of course, not chemotherapy the way we know. And so there are other doctors. Even there is a very well-known physiotherapist, Dr. Hathi, at the Churchgate station, where I used to go to when I met with a severe car accident. But I don't know whether he would have the time to come on 5 in the evenings and talk to people. But I can always inquire if he's game for it.
Right. No, we will, the idea is to get as many people as possible. And we are now looking at getting people from across. Anybody else would like to...
or a nutritionist also, Mr. Maheshwari. A nutritionist who can advise different patients on different illnesses that they have and the kind of food that every individual patient would require to take. That would also be very interesting.
Right. Great. What I'm going to do is, ma'am, if you, I'm going to send you a list of all the webinars that we've had.
Yeah.
Right. And some of these things you can perhaps look at. We've had nutritionists. We had a nutritionist recently, as recent as Diwali.
Okay.
Okay. So I will send you links to all the webinars we've had.
All right.
In fact, for everybody here, those of you who would like to visit our earlier webinars, we've had over 100 odd sessions with doctors, and all of them are available on our website, and which is seniorstoday.in/webinars. So you can have a look at that. And I'm sorry, I'm trying to reach Dr. Shaikh.
You got you under my.
Dr. Shaikh, this is Pradyuman Maheshwari. So what happens is, this is a Saturday evening, and doctors have their OPDs. And when we started out, it was the lockdown, and everything was doctors were more easily available. But now it's not so. But in the meantime, anybody else would Mr. Suresh Ghate, would you like to say something?
Yes. Yeah. I would like to suggest the effects of or bad effects of medicines on body itself. Because many times we take medicines on blood pressure and all, and then there are reactions on the body.
Very good idea. We will get an internal medicine specialist to do that.
Yes, thank you.
We will get an internal medicine specialist to do that. Yeah. Thank you. Hello, Dr. Shaikh.
Hello, Pradyuman. How are you?
I'm good. So let me introduce Dr. Shaikh. Dr. Shaikh is Dr. Muzammil Shaikh is Director of Medical Oncology at the Nanavati Max Super Speciality Hospital in Mumbai. He is a graduate from the Grant Medical College and Sir J.J. Hospital of the University of Mumbai. He did an MD in Internal Medicine from the St. G.S. Medical College and KEM Hospital, and later a DM in Medical Oncology from the Gujarat Cancer and Research Institute. He had a DNB in Medical Oncology from the National Board, New Delhi. With over 2 decades of experience, Dr. Shaikh has been the consultant medical oncologist also at the Hinduja Hospital from April 2013. In May 2013, he did an observership in MD Anderson Cancer Research Center at Houston in the US. And before that, he has been associated with the Hinduja Hospital for many years. He is a member of the Indian Cooperative Oncology Network, Indian Musculoskeletal Oncology Study Center Study Group, the European Society of Medical Oncology, and the Mumbai Hematology Group, and the Indian Medical Association, of course. Welcome to Health Live at Seniors Today, Dr. Shaikh. How have you been?
Thank you so much. Thank you, Pradyuman, for that kind introduction. And I'm very glad to be here to share some, experience and some knowledge sharing for, increasing awareness of this unusual, now common actually disease, which we are seeing. As we remember when I was small, we used to hear one cancer patient in the entire colony, where I used to stay. Now practically every building has 2 or 3, which means that, there is a real increase about this cancer numbers. And it's high time that we are aware of the common signs and symptoms so that we can report early for a medical help.
Right. Doctor, I know people who are otherwise fighting fit, right? They do their 50 minutes of exercise every day and all of that, and they suddenly find that they have been afflicted with the disease. What is the reason? Why does it happen to somebody?
So the cancer happening to people, there are multiple factors which are there in one particular case. It's different for different individuals, different from males, different for females. It's usually multifactorial in most of the cases. Having said that, many of these cancers are actually man-made, approximately 30 to 40%, which is a huge number. And this is because we have created our environment in such a way that we are seeing more cancers. And unless until we do something now, we are going to see these increasing numbers in future also. I am talking mainly about use of tobacco in any form, whether it is gutka, cigarette, filtered cigarettes, hookahs. So most of these tobacco-related cancers are preventable by and large. But it requires a lot of effort from the government, from ourselves, everyone to reduce. And of course, the second big thing which has occurred, and which is again, I say that we are catching up the cancer rate in US and Europe, and that is because we are following the westernized lifestyle now. So decreased activity, you know, burgers, fries, cokes, all these kind of foods have actually increased the pandemic of obesity in our children and our population, and which actually is reflected as increased number of cancers such as breast cancer or endometrial cancers, prostate cancers, colon cancers, etc. So I think a lot of things we can change. Certain things which we can't change is our aging process. Now since we are living more, when 50 years back, average age of an Indian born was 55 years. We used to die at an age of 55, and that was because it was an average. And now the averages has gone to 68, 72. In Japan, it is 84. What it simply means is that with better facilities of simple diseases, like blood pressure, diabetes, heart illnesses, we are living more. And if you're going to live more, there is a high probability that you will develop cancer, because as you keep on aging, your cells becomes abnormal, okay, or your immune system becomes weak. That is where you develop these cancers with increasing age. So the other reason is because we are going to see more and more aging population in next 2 or 3 decades. We may end up seeing more cancers also. So there are many reasons which has increased this cancer around us.
Right, absolutely, Doctor. Those of you who have questions, please put them for Dr. Shaikh. I will look at the questions and address them to Dr. Shaikh. But tell me, Doctor, are we in a situation now in India where there are enough medical facilities for cancer across the country? I still remember the days when one would pass by Parel in Mumbai, and there were crowds across Tata Memorial Hospital, and it was a very scary thing, and everybody would need to come to Mumbai for cancer treatment. Now, of course, one hears of cancer hospitals across the country. In Mumbai itself, for instance, you are at Nanavati Max, which has an amazing cancer facility. So a word on that is: do people still need to come to Bombay for cancer treatment?
No, Pradyuman. So that's a very, very good question about the infra. So I will just give an example. When I passed my DM oncology training, when I came as an oncologist, there were only 12 candidates in the entire country who will get this degree. Only 12 for a population of say 1.2 billion. So that was the status. And now, each year there are more than 200, 300 super specialists, cancer experts coming out of in our country. And that too, still it is low, I say. It is still low, but it is much, much better than what it was 15 years back or 20 years back. Now, if you see smaller cities like, say Baroda, say Nashik, Pune is a big city, even Aurangabad, they have qualified cancer experts, surgeons, oncologists. Many have radiation units there. So all these small second-tier cities also have good cancer facilities now. The real increase, Pradyuman, actually why the cancer has increased is because we have better diagnostic facilities now. So there is definitely increase of certain cancers because of lifestyle. say breast cancer or endometrium cancer. But the actual increase is because now we have facilities to diagnose them. 20, 30 years back, we were not biopsying those nodes or glands or not getting a diagnosis on a particular patient. But now we are able to diagnose them and keep a record of that. And that has caused a sudden increase of cancer cases in our country, which was always there, maybe a little bit lesser than what it was, today. So I think facilities definitely have increased. The government has put a lot of efforts. There are a lot of infra provided even at tertiary care centers and all. But unfortunately, certain expertise like really complex liver surgeries or certain immunotherapies or other drugs, they are still restricted to metros right now, which eventually will change because it's all about getting the things right, and government is moving in the right direction with a lot of national cancer control program running. So many things are improving. Things are better, I will say, much better in last 15, 20 years, but still a long way to go because our population is just too huge.
So would you then, I'm still waiting for questions to come in, but until then, would you say that, in case of very basic kind of cancer, whether say breast cancer or something in stomach or whatever, there's no real need to travel to a Mumbai or a Delhi or a metro? Is that taken care of in a tier 2?
Yes, absolutely, Pradyuman. There is no need to travel to any of these metro cities for straightforward, simple cancers, which will have very fixed protocol of treating. The surgeon will operate, the doctor will give some chemotherapy, radiation will be given. So these are, very straightforward cases where you don't require to travel at all.
Doctor, I still remember going to a Tata Memorial Hospital as a junior journalist, and I saw over there was a counter meant for train concession.
Yes.
So which meant that people from who had cancer were getting concession on train tickets. That still exists, but it just showed that people needed to travel to a Mumbai to do that. So it's very heartening to note that that treatment is available across the country, and it's good quality.
Yeah, it is. So what happens still Tata is as crowded as you saw, maybe more than that, honestly, because, the population is huge, and there is some kind of a faith in Tata, particularly as an hospital, because it is of that repute. So people, at least for one opinion, will come here. They will travel all the way because, certain aspects are still to improve. COVID has shown, some path to people. Like, I remember a lot of patients used to come to me when I was at Hinduja and now at Nanavati from out of Bombay, so from interior Maharashtra or right from Bengal and UP, and they should travel with those concession passes which we have at our hospital also. But now post COVID, they realize that we coordinate with the local doctors there. We found out who are the oncologists there, and which centers are giving chemotherapies. So we directed them with some referral letter and protocols, and then they started getting the same treatment there, and they were quite happy with certain not all cases, I will tell you honestly, because it's about the manpower and the training of the nurses, junior doctors, everything which matters, because cancer care requires a complete team, which we should be in a sync. So certain things puts you off, and then you don't want to take therapy in say UP. You will say, no, I will go to Mumbai, Tata or Nanavati, because your experience was different here. But having said that, now many patients who were coming here, they just come for one opinion to us now. We write the protocols, they go back to their native states, and they take the therapy there. That saves lot of time and effort and money for those patients. So I think that is happening on a very routine basis, which was not there earlier.
Tell me something, doctor. One last question on this issue. Supposing somebody is from a tier 2 town, can they consult? Can they consult Dr. Muzammil Shaikh? By a call or by a webinar, a web call or whatever. Is that possible?
Yeah, Pradyuman. So every day, this is, it's not very right, but then in my car, because the whole day I'm busy, my car is my teleconsultation time. That is video consultation. So all patients, so every day I will see at least 5 to 7 patients from out of Bombay, some from out of India also. So they will send all their reports to the hospital. It will get uploaded. I will give them the time, usually when I travel back home. And I try to, give 15, 20 minutes to each patient, get everything sorted out, and then go back, type all the recommendations, and then, we email them or WhatsApp them. So it is happening every day for me. And post-COVID, people also prefer to do that. So something as simple as just getting an idea of a PET scan, what it shows and all. You need not travel all the way to Bombay. Or forget about that, with this whole Bombay dug up with metro and other work, people from nearby suburbs also, they don't come. They say, can we do a teleconsultation? I said, oh, why not? So it saves time, and I am more than happy for smaller things, like just follow up and understanding certain things. Teleconsultation is wonderful, absolutely wonderful. So
Doctor,
I am doing that on a daily basis.
Doctor, you are at Nanavati Hospital, and those of you who are from Mumbai know that the famous Bridge is shut. So it is quite an effort to get
It is.
to around the city. But be that as it may, I think the issue is that yes, medical care is available, and doctors like yourself are available for teleconsult. So that's a very heartening thing. So how does one do a teleconsult with
So
yourself?
our hospital board has numbers. They can contact our secretary, our coordinators, hospital board, and they arrange for a teleconsultation appointment. There is a software to the hospital also through which you can do, or sometimes they go through the hospital, but WhatsApp. That hospital arranges everything. So this is very coordinated one.
Fantastic. Doctor, we have a few questions that have come in. I'm going to ask you the first question, which is from Mr. Basavraj Nagashetty. Those of you who are asking questions, you can also mention your age and your gender so that doctor can ask, but these are general questions. Mr. Basavraj says, there's a history of cancer in our family. My father and uncles, as well as my two elder brothers, also succumbed to cancer, mostly throat cancer and lung cancer. Under this circumstance, what prevention should I have to take, and what precautionary medical tests should I have to go? I never use tobacco in my form, he says.
Right. So two aspects to this question. One is what he brought out was, genetic linkage to cancer. So just few words on that. Out of 100 cases I see, or rather anywhere in the world, only 10 to 15% will have a genetic basis, which means that the cancer runs in families. 90% of the time there is no history. Okay. Now, if there is a history of cancer in the family, we try to understand what kind of a history that is. Is it relevant to be investigated? Like if someone is having, someone's grandfather has a cancer at 75, that is not significant for us. Okay. It is the age at which a relative got a cancer. So someone gets cancer at age 50 years or lesser than that. Now, this is not an age to get cancer, any cancer, in fact. So we start wondering, whether this is genetic or not. If there are too many family members who are younger in age and develop cancer, then it's a strong family history. Okay. So the family history should be relevant. And there are certain cancer subtypes, like, a throat cancer with a lung cancer are both not fitting into any syndrome. Certain genetic abnormalities will have cancers, which will be, particular kind actually. Understood? So in his Basavaraj's family, uh, the cancer types are not matching into any syndrome. Plus, I don't know the age, but if they've got cancer at age beyond 50 years, again, it is not very, very strongly related or relevant, genetically. But still, as a matter of fact, whether what precautions should we take, that is the second part of this question. Is that is true for all cancers? What precautions you take. Certain cancers are preventable, like tobacco. Now he's not using tobacco. So for him, if he's asking particularly about lung cancer, then since he's not smoking, there is nothing more required actually. There is no test like a screening test, which he should keep on doing every fixed interval to pick up a lung cancer. Okay. So the screening test is mentioned only for high risk cases, like a heavy smoker.
Like, doctor, what do you think about the gene test? What is your view on the gene test? Is that something that is advisable for somebody whose parents, whose mother or father may have had cancer at an early age, and should the child then take a gene test?
Yeah. So the gene test is same genetic test for finding out risk of cancers. So if there is a family history which is matching a particular syndrome or matching a risk of genetic cancers, then there are plenty of tests to be done. But the most important part is not doing the test yourself or by advice of a general physician or someone, because these are very dangerous tests. When I say dangerous, because I see this every day. The biggest example or the role model or ambassador is Angelina Jolie. She is a Hollywood superstar whose mother was having breast cancer, and the mother got tested because she got at a younger age, and she was positive for a gene test, a genetic abnormality called as BRCA, breast cancer antigen. Now, if one is positive for that, there is a very high chance that you will get breast cancer in your lifespan, or ovarian cancer, or certain other cancers in yourself and the other family members related to on the mother side, on the female side, you can get cancers. So Angelina Jolie got her tested because her mother was positive and she was also positive. Now she is a healthy lady, a superstar in Hollywood, but she took a bold decision to do a preventive step, and that was removal of both the breast and both the ovaries. Now, for a normal person, just with this test, taking such a bold decision is not easy in our societies. It is very difficult. So I know families, or I know young girls who have done this test, and then eventually they don't know what to do. They don't have the courage to get operated, remove both the breast when they are normal. At the same time, that fear of getting cancer is very high. So they have made them really, crazy, and they are on medications for depression, anxiety, and all the stuff. So before doing a proper genetic counseling by a expert, genetic counselors or the oncologist, never do any genetic test, because the test wala people will promote their test because to do business. Okay, but we should not fall into the trap. We should always consult an expert to understand whether this test is really needed for my family or for me, and if it is needed, what are the repercussions of having a positive test, including medical insurance. Many medical insurance don't cover genetically acquired diseases, and employments, certain employees may have issues. So I think all those things are very sensitive, so it's not a simple test. Take an opinion first, counseling, and then do the test.
Right. Thank you, doctor. We have another question which is similar from KV Brahmanand Rao. He says, my wife passed away due to stomach cancer at age 62. I have 3 daughters in the age group of 45 to 49. Should I worry?
No, so as I told you again, it is more than 50 years, and stomach cancer particularly doesn't fall into many genetic groups or genetic acquired cancers. So I think he should not be bothered about the daughters getting that same cancer or similar cancers. You should just maintain a healthy lifestyle, body weight, exercise. All of this goes for a general instructions, nothing more.
Right. Thank you. We have a question from Jayanti from Bangalore. She says, my mother was diagnosed breast cancer second stage, got left breast removed 6 to 7 years back when she was 75, 76. Considering the age factor, she wasn't given chemo or radiation. She has been given Fempro calcium for lifelong with follow-ups. Now she's very reluctant to come for a follow-up. This year, her HbA1c was about 6. Her ALT was 12. Any chance of recurring at this age? She refuses to come for a mammo or abdominal scan, and she is 82 now.
Yeah, so which clearly says that she's 7 years beyond the diagnosis. So, there is a small chance in hormone positive. Her mother has an hormone positive tumor for which she's on a hormone agent called as Fempro or Letros. So this drug is given for typically 5 to 7 years and not lifelong. Okay. So you should consult your oncologist. She has already completed 5 years, in fact, 7 years. Maybe we can stop the tablet now anyways, because the added benefit is not there. Now, regarding the risk of recurrence here, it's going to be very, very small, very less chance of it coming back. Ideally, one should follow. If she's not following, you can't help it. You can't, really force her to follow. But maybe whenever she's coming for some different reason, you can just do a simple sonography or a simple test and just get a, as a routine health check kind of a stuff for her once a year. That should be sufficient.
Now, you had mentioned, she said that she got her cancer second stage when she was 75, 76, she got her breast removed. So her second question is, are there any chances of her daughter getting cancer?
So again, same. Age is the most important factor. 75 is a normal aging process where she got cancer. So age is the biggest factor here, and not the genetic inheritance. If she would have got it at less than 50 or there are other members with less than 50, then you should do the genetic testing. So again, for her daughters, you should just do a mammogram after age of 50 years, once in 2 years or so, which is a routine recommendation for other people also.
Right. Thank you. We have a question from Feroza Pitawala, who says, I have low blood platelets after a drug reaction. Is it a precursor to any cancer?
Not really. So thrombocytopenia or low platelet can occur in various conditions. Okay. If they are within the safe limit of say maybe 75,000, it's different for different places. Some take 50,000 as safe, some 75. So if it is above 75 or 1 lakh and his other parameters are okay, I think there is no additional risk of developing cancer because of that. Having said that, this information is not adequate for me to make a judgment here. You should always visit a local MD or a hematologist to understand why there is still platelets low. You know, there is something deficient in their, say, multivitamin or something which is deficient, which can be corrected.
Right. Doctor, this is from Dinesh Paliwal. He's 71 male. Is Cologuard for colon cancer screening available in India, and where?
No, we are not doing it in our country, because for any screening test, there should be, you know, that number of cases in a community where that screening test becomes feasible or viable. Okay, we are having colon cancers, quite a significant, but not as large right now, where we are using it in a routine thing. But yes, one can import that and do that. But when you talk about screening tests, then it's an initiative taken by cancer bodies or by governments to reduce the incidence or catch up, you know, cancers early, like cervical cancer screening, the cancer of the mouth of the uterus, you know, in females. Now that was a real worry for our Indian females. So there is a cervical cancer screening program. Okay, but there's nothing like a colon cancer screening program in our country because the incidence is low. It is not the burning issue for our country currently.
Right. Thank you. We have a question from Katie Dalanchi. It says, Doctor, does consuming non-vegetarian food increase our chances of getting cancer?
No, so it is not the non-vegetarian food. It's about if you're taking, you know, a lot of those, you know, seasoned food which are kept in those big supermarts for months and months, and then you use them. Those are really not that great. Taking any fresh non-veg is not going to increase the risk of cancers. Okay.
All right. Thank you. A question from Mr. Bharat Mehta. He says he's 66. Chances of prostate cancer is more in man surviving after 65 years. What precautions should one take to avoid prostate cancer?
So two informations here. One is that, yes, it's a fact that beyond 60 years, you will have a higher chance of developing any cancer to that matter. But prostate cancer is increasing in number in our country also. So one of the risk factors is actually obesity, which is there, and lot of poultry, meaning milk and milk products used for a long time is a small risk, not the most proven one. So there are a few risk factors, not one in a particular patient, where you can develop cancer. So nowadays, 66, unfortunately, you can't undo. You can't change things now. So if you're going to get a cancer, you're going to get a cancer. By modifying anything today, you're not going to really prevent it. Okay. So now the other part is, what should we do? You can do a PSA testing, which is a blood test done in once a year. Any standard lab will do to find out whether the PSA is going up or not. So all who are beyond 60 years, as a routine health check, also you will see their packages. In those packages, PSA is one of the tests which is done in most of the packages because it can be elevated, it can pick up cancer sometimes in the prostate.
Thank you. We have another question from Katie Dalanchi, who's 71. Says, Doctor, should we get a mammography done regularly every 2 years? Is the radiation not harmful?
Yeah, so I think assume the patient is a female patient asking this question.
Right.
Yeah. So because there are some cases of male breast cancers also, but we take it as that, you know, you do a test based on how many normal individuals you're helping in a society. In our country now, over last 3 decades, because of the westernization of our lifestyle, late age of marriage, you know, late first child, inadequate breastfeeding, OC pills, obesity, all this has really increased the cancer incidence in India as far as breast cancer is concerned. So this is a real jump. And if you see, there is a huge divide if the female lives in a city or in a rural place. So in rural India, currently, still cervical cancer is the commonest cancer in females, whereas in urban India, say cities, metros, breast cancer has become the most commonest cancer, and it is increasing at an alarming pace. And reason is that there is a lifestyle change, a huge lifestyle change between the same female, genetically an Indian, but there is a huge difference in the incidence of breast cancer in the same females. So the environment is working on her. Okay. So, doing a mammogram, if the incidence is very high, say in Europe and America, the incidence is very high. So if you do a screening test in that population, you will pick up more cancers and treat them early and prevent more life and save many lives. So that has got huge impact. When the same we try to apply in India, India's uniform, the population is not very uniform. So I can't say at the national policy level that every female in India should get a mammogram done at 2 years, because then I am exposing too many normal people to radiation, which itself can, cause cancers. So after so many, say, so many billion, so 1.3 billion, meaning easily say 70, 80, when we're talking about having as a female population, if I subject all of them, lot of them who are above 50 to doing a mammogram 2 years, I may create more cancer than I'm curing. Okay. So select. So that is why it is not still in our national policy to do a mammogram to all. But as a recommendation, say patients who are in cities who come and ask us, we do say that, because in urban cities, the incidence of breast cancer is high, we do say that do a mammogram every 2 years. The world body says once a year, but we want to rationalize, we want to make it more practical. So we say, at least 2 years you do one mammogram. If anything abnormal, then you may repeat one after 1 year. That way, we are reducing the chances of developing radiation-induced cancer.
Right. Thank you. So I hope you have had the answer, ma'am. Now we have another question from from Suresh Khate. It's an interesting question. What are the basic indicators of showing that one is suffering from cancer in the body, and which pathological tests should be carried out for detection of cancer?
Right. So this is a very valid and relevant question here. So there are certain telltale signs of cancer or certain signs and symptoms which one should not ignore. So if there is a cough, dry cough, wet cough, a cough which is not improving for more than 4 weeks of treatment by your family doctor, then don't ignore it. Get a scan done, because this could be a harbinger of something more ominous underlying. If there is any blood loss, either through the urine or in the stool, get it checked by your local doctor. By the in the urine, anytime it is to be taken very seriously. In stool, many times we have piles or fissures and we tend to ignore. But if it is happening on and off again and again, better get it checked by your doctor or the surgeon, because many times we see quite often that the history was for 1 year and this person has thought it's a piles, and it came very late to us. So any bleeding, either through the stool or through the urine, should be taken very seriously. Any bleeding through the nose which is not settling down should be taken very seriously. Any cough with blood in it should be taken very seriously. For females, any nipple discharge or discharge from the skin of the breast.
I think we have a slightly weak connection. We seem to have lost Dr. Sheikh's. Let's hope he joins again. Let's hope he joins again. Else, we will get him to get you the answer in case he's not able to join us. He's here again.
Sorry, I lost you all.
Yeah, no problem. Yes, doctor. So you were talking about about.
Yeah, so I was talking about signs and symptoms. I have covered any blood loss through the urine or stool, any significant weight loss. When I say weight loss, it is more than 10% of the body weight in last 6 months. If you're not doing intentionally, if you're not dieting and trying to lose, that should be taken very seriously. Any change in voice, which is not improving, hoarseness of the voice, you should immediately report. Any lumpiness in the gland like in the neck or axilla, should be taken very seriously. So all these are signs. There is a skin mole, and now it has suddenly changed the color, or it has become suddenly large. It has been there for years, or it starts bleeding. All those should be taken seriously and reported.
Right. Thank you, doctor. This was very helpful. Two more questions, doctor. One is from Pravina Tiwari. Her question is, what are the symptoms of skin cancer?
So skin cancer is fortunately very, very rare in our country currently, because we are blessed with a black skin, which has a lot of melanin, which protects against the ultraviolet rays. Having said that, still some skin cancers we do see. Melanoma is one of these cancers which causes black pigmentation kind of a thing in the skin, which can be sometimes very fatal. So if you see any mole or any black pigmentation on the skin, which has suddenly changed its color, size, or bleeding, you have to immediately take note of it and meet your local doctor there. Otherwise, any lump or any ulcer on a skin which is not healing, you should have a biopsy done if possible to rule out a skin cancer.
Doctor, when you mention local doctor, what level of a doctor should one be meeting?
So it will be first visit is usually to the family doctor, but if some biopsy or something is required, it's usually the general surgeon in that area who will be the right person to guide you.
Right. Thank you. So, doctor, one more question is coming. The one question is from an anonymous attendee: have thyroid cancer, had total thyroidectomy, and it recurred? What are the chances for me to get a normal WBC?
So I think I got a little bit confused with this question, but thyroid cancers are one of those cancers which are highly curable cancers in our body. So even you operate and then after that, suppose the disease comes back, it is still highly curable. So even in stage 4 cancers in thyroid, the cure rates are extremely high. And the therapy is simple radioiodine therapy. Okay. So if you take this radioiodine therapy, sometimes blood counts can go down. That is what the question I understood they wanted to ask. So sometimes after therapy, your counts may be low for a few months. Sorry. But eventually it improves as time goes.
Right. Thank you, doctor. Doctor, two more questions. This is from Mr. Eman Rao. He's 82 years old, male with prostate for a decade, continuously on Tomsolin 4.4 mg, except for frequent visit to the washroom in the night, no other problem. Other problem is COPD. What precaution should he take? He is 82 years old.
No, I think he has lived gracefully and he has enjoyed life 82. I think I salute you for that. So without bothering much, you continue doing your good and enjoying life as you are. Having said that, certain precautions, which is there, you should do your PSA at least because you're developing urinary symptoms. So do a PSA once a year, if required, sonography of the prostate to pick up any cancer which can occur at this age, especially the prostate. Rest, there is a long list. We can't keep on checking yourself, at age 82. Just a routine health check packages will cover most of the things.
Right. Thank you. We have another question from also from a second question from KV Brahmanand Rao. He says he's 73. His PSA test result is gradually increasing over the last 4 years. Latest is 5.2. His question is, what should he do?
He should meet a urologist close by and get himself evaluated.
Right. Thank you very much, Doctor. I know you are in the car, and in a city like Mumbai, I guess, but you have very good connectivity, which speaks a lot for our telecom vendors. And thank you very much, Doctor, for taking your time. I can understand what a busy schedule you have, and we would love to have you once again. We've had doctors from oncologists from Nanavati Hospital in the past, Dr. Advani, Dr. Nagarajan, and the person who heads the department as well. And I forget his name now. But we've had and really glad to know that there are cancer specialists not only across the country but across this mini country of Mumbai, which is, Vilipale to Parel is as much as, say, Bombay to Delhi, travel time, right? Thank you very much, Doctor. And for all of you over here, we will be back once again next Saturday at 5 p.m. for our next session of Health Live at Seniors Today. As always, those of you who would like to be informed about our next session without having to wait for the notice, you have the pre-registration link, which is there in the chat window, and you can speak to us there. Right now, as we speak, we are working on the latest issue of Seniors Today, which will be out on December 15th. As always, free of cost for you, and you can read it. There are some very interesting issues, very interesting stories that we have in this issue, so you can wait for it. And we will, of course, give you a preview of the magazine next Saturday. Thank you very much once again, Dr.
Thank you, Pradyuman. Thank you, everyone. I will be in touch with you all. Nice. Thank you.